fluid content within the brain. Another treatment is a third ventriculostomy, and here on the right is a endoscope that is placed through the brain parenchyma into the lateral ventricle, through the foramen Monro, and then through the floor of the third ventricle. This is a useful technique for obstructive hydrocephalus, but is not of benefit for communicating hydrocephalus. In the past, people have attempted to perform a choroid plexotomy. Walter Dandy had done this early in the 19th century. Unfortunately, most of the people who had this performed died. The most common treatment is a ventricular shunt, and this is when a ventricular catheter is placed into the ventricles and then tunneled distally, either to the pleural space, peritoneal space, or sometimes also to the atrium of the heart. This is a video of a third ventriculostomy. This can be found on YouTube, and this is performed by Paolo Regalo, who is a neurosurgeon. On the right are various ventricular shunts. The child on the left has a ventricular peritoneal shunt. The child on the right has a ventricular atrial shunt. This is a fairly rare shunt that can be performed where the drainage is connecting the lateral ventricle to the subarachnoid space. On the right is a lumbar peritoneal shunt. The catheter, which can be seen by the iliac crest, drains from the lumbar cistern and then to the abdomen. This is oftentimes used for some types of hydrocephalus when the ventricular system is not enlarged. Depicted on the left-hand side here is a gentleman from the Boston area who developed the first shunt. And the story is that his child had hydrocephalus, and at the time there was no cure. His child was going to die, and he was an engineer. He figured he could make a shunt, and he developed the first shunt that was then implanted in his child and saved his child's life. Modern day shunts have changed to some degree, and there are now some that are programmable shunts, and this allows us to adjust the pressure gradient from which the cerebrospinal fluid drains. These are just some additional types of modern day shunts. Depicted in these x-rays of the head these are skull x-rays of children that have had multiple shunt revisions. If the shunt is in place for an extended period of time, sometimes it can become adherent to the choroid plexus, and if one was to attempt to remove the shunt, they may tear the choroid plexus, resulting in bleeding. As such, sometimes we just leave the ventricular catheter within the brain and place another from a different location. This is the abdomen of a child who's had multiple shunt revisions. The malfunction rate in the first year is upwards of 17%, so it's not uncommon for people to have a shunt that obstructs over time. Switching gears, I'd like to talk about cerebrospinal fluid leaks. This oftentimes occurs following trauma in which there's a fracture in the skull, and cerebrospinal fluid will communicate between the ventricular system traversing the fracture of the skull and then will drip out of the nose, in the back of the mouth, or out of the ear. Cerebrospinal fluid leaks can be detected by leaning forward and increasing intra-abdominal pressure. Here you can see a drop of cerebrospinal fluid from this woman's nose. The incidence is fairly rare, with only 2 to 3% occurring after head trauma. They usually occur within a few days. The majority will stop within a week, 30% within 6 months. Some do not, and they require surgical intervention. So the treatment for a cerebrospinal fluid leak oftentimes consists of bed rest and at times an epidural patch if there was a leak from the lumbar spine as is depicted on the right hand side. This is a complication that can occur when performing lumbar spinal surgery, such as a microdiscectomy or a fusion of the lower spine. The whitish area or hyperintense area on this MRI depicts a fluid collection as a consequence of a dural tear. The picture on the right demonstrates the characteristic halo sign when CSF is found on a sheet. CSF can also be identified again by its glucose content and also by the presence of beta-2 transferrin. Treatment of cerebrospinal fluid leaks, as I've already alluded to, consists of bed rest, lumbar drain, and then at times surgical. This is the conclusion of my talk on cerebrospinal fluid and the ventricular system. Today I have reviewed for you the anatomy of the ventricular system, which is identified by the characteristic C shape or ram horn shape of the ventricles. We've discussed the different ventricles, including the lateral ventricle, the third ventricle, the fourth ventricle, these being connected by the foramen of Monro, and then the cerebrospinal fluid leaving the ventricular system through the foramen Magendie and foramen Ilushka. We've talked about the content of cerebrospinal fluid and the normal production. Approximately 1 can of Coke a day or the equivalent. And we've also talked about abnormal accumulation of cerebrospinal fluid, which results in hydrocephalus and the various treatment options for hydrocephalus. Lastly, we've talked about cerebrospinal fluid leaks and the different types of treatments available for them. I hope that you have enjoyed this lecture and that you found this to be beneficial. Thank you.